Gentlemen, let me ask you a question that may feel uncomfortably familiar. When was the last time you woke up with the kind of automatic firmness you once took for granted? For decades, morning erections were as natural as breathing. They appeared without effort, a quiet sign that your body was working, that your vitality was alive and well. But somewhere after 50, and especially past 60, many men notice that this morning signal grows weaker, or disappears altogether. And when it does, it is easy to think, well, that's just age, nothing I can do about it. But what if that assumption is wrong? What if fading morning erections are not a sentence, but a message? A message that your circulation, your nerves, and your muscles are asking for support. You see, the body is not designed to simply shut down passion or vitality with age. Instead, it adapts. And when we learn to work with those adaptations, incredible changes can happen. I'm Dr. Sophia Carter, a urologist who has spent over a decade helping men reclaim their sexual health with science, not gimmicks. And today, I want to reveal something few men know. Hidden pressure points in your pelvic region that, when stimulated gently and regularly, can actually reawaken the body's natural erection mechanism. These points are not about quick tricks or magic buttons. They are gateways to circulation, nerve activation, and muscular support, all working together to bring back what you thought was gone. Stay with me, because in the next few minutes, you'll discover how 3 simple pressure points could help you rise again, naturally, every single morning. Before we talk about pressure points, we need to understand why morning erections matter so much, and why they tend to fade with age. Many men believe these changes are purely about desire, but the truth is deeper and far more biological. Morning erections are not random. They are a natural health check, triggered by your nervous system during deep sleep cycles, especially REM sleep. When everything is working properly, your nerves, your blood vessels, your hormones, your muscles, you wake up firm. When one piece of that puzzle weakens, the signal fades. Think of an erection as a finely tuned orchestra. The brain sends electrical impulses down the spinal cord, telling the smooth muscles inside the penis to relax. As those muscles loosen, blood rushes into the erectile chambers, filling them like balloons. At the same time, veins that normally drain blood away are compressed, locking the blood inside. The result? Firmness. Simple in theory, but in practice it requires flawless cooperation between brain, blood, and muscle. Now here's the challenge after 60. First, circulation slows. The arteries in your pelvic region lose some of their youthful elasticity, making it harder for blood to surge quickly when needed. Second, nerve signals weaken. Those lightning-fast impulses that once fired instantly may now travel more slowly, arriving softer and less effective. And third, the pelvic floor muscles, those hidden supports beneath your core, often lose tone, meaning the body struggles to trap blood inside the penis, even if it gets there. This is why so many men past 60 wake up with only a faint pulse of firmness, or none at all. But here's the good news. These systems can be reawakened. Pressure point stimulation works by directly activating clusters of nerves, encouraging blood vessels to open and gently retraining pelvic muscles to hold firm again. In other words, it helps bypass some of the age-related slowdown and gives your body a natural boost. No pills, no risky treatments, just your own hands working with your body's design. Pressure point. 1. The perineal power switch. The first hidden pressure point is located in a place most men rarely think about, the perineum. This is the area of soft tissue between the scrotum and the anus, often overlooked, but biologically one of the most important gateways to male vitality. Why does it matter so much? Because right beneath this spot lies a dense network of nerves and blood vessels connected directly to the pelvic nerve plexus. This plexus is like a central hub, carrying signals that control erections, ejaculation, and overall pelvic function. When you stimulate the perineum gently, you activate those nerves, sending a wake-up call to the erection center in the spinal cord. In response, your smooth muscles begin to relax, your arteries widen, and blood flow into the penis increases. But that's not all. The perineum is also directly linked to the pelvic floor muscles, sometimes called the hammock, that supports the penis during erection. Over time, these muscles lose strength, which makes it harder to stay firm. Gentle massage or pressure on this area not only triggers nerve activity, but also reminds those muscles to engage. It's like flipping a forgotten switch. Suddenly, circulation and muscle tone are working together again. Here's how to practice. Sit or lie down comfortably. Using 2 or 3 fingers, apply steady but gentle pressure to the midpoint of the perineum. You don't need to press hard. This is not about force but about awakening. Hold for 15 to 30 seconds, then release. Repeat this cycle 3 to 5 times, breathing slowly and allowing your body to relax. With time, many men notice a tingling warmth or a sense of fullness in the pelvic region. That's blood flow returning. Regular practice of this simple routine can restore sensitivity, strengthen the natural reflex pathways of erection, and bring back the firm morning rise that feels effortless, not forced. It is discreet, safe, and remarkably effective when done with consistency. The second pressure point hides in plain sight, along the inner thigh just inches away from the groin. If you trace your hand upward from the knee to the crease where your leg meets your pelvis, you'll feel a tender zone where large blood vessels and sensitive nerves travel together. This is the inner thigh gateway, and it plays a vital role in sexual performance and morning erections. Why is this area so important? The femoral artery and vein, along with branches of the pudendal nerve, pass through here. These structures act like highways, carrying blood and electrical signals toward the pelvic region. As men age, tension in the thigh and groin muscles often compresses these pathways, making it harder for blood to flow freely. Gentle stimulation of this point helps relax those muscles, encouraging circulation to surge more easily into the erectile tissue. There's another hidden benefit. The inner thigh is neurologically connected to the pelvic floor muscles, the very same muscles that contract during climax and help trap blood inside the penis. By applying light pressure or massage here, you send a reflex signal that tones and activates those muscles. Over time, this improves your ability to maintain firmness, even when your circulation isn't as strong as it used to be. Here's how to practice. While seated or lying down, place your thumb or fingers about 3 to 4 inches from your groin along the inside of your thigh. Apply slow circular pressure for 20-30 seconds, then move slightly outward and repeat. Work gently up and down this region for 2 to 3 minutes. The goal is not to bruise or press hard, but to relax tension and awaken nerve pathways. Many men describe a sense of warmth spreading upward into the pelvis, almost like a light switch being turned back on. Done consistently, this practice not only improves morning erections, but also enhances overall stamina, making it easier to sustain firmness during intimacy. Think of it as removing roadblocks and clearing the way for stronger, more reliable blood flow. The third pressure point is not directly on the genitals at all, but just above them, on the lower abdomen, about 2 fingers below the belly button. At first glance, this may seem unrelated to erections, but beneath this small region lies a powerful network of nerves and blood vessels tied to pelvic circulation, hormone balance, and sexual vitality. This area is home to the hypogastric plexus, a cluster of nerves that acts like a command center for communication between the brain and the pelvic organs. When these nerves fire strongly, they stimulate the release of nitric oxide, the chemical messenger that tells blood vessels in the penis to expand. But with age, nerve conduction slows, and this signal weakens. By applying steady, mindful pressure to the lower abdomen, you stimulate these nerves directly, giving them the boost they need to reawaken their full strength. There's also a hormonal connection. The lower abdomen sits right above the pelvic cavity, where blood supply to the testes and prostate is regulated. Gentle stimulation here can encourage circulation to those glands, supporting testosterone production and overall balance in the male reproductive system. Many of my patients are surprised to learn that a simple routine focused above the groin can improve firmness below it, but the body is deeply interconnected in ways we often overlook. Here's how to practice. Lie down comfortably on your back. Place the palm of your hand or the tips of your fingers just below your navel. Apply light to moderate pressure in small circles, breathing slowly as you do. Continue for 2 to 3 minutes, focusing on relaxation rather than intensity. Some men notice a subtle pulse or tingling in the pelvis after a few sessions. This is a sign that circulation and nerve response are waking up. Used regularly, this lower abdomen technique complements the first 2 pressure points by tackling the problem at its root: communication between nerves, hormones, and blood vessels. Together, they create the conditions for strong, natural morning erections that feel effortless, not forced. Now that you know the 3 hidden pressure points, it's important to understand how to use them in a way that is safe, sustainable, and effective. These techniques are not about force or intensity. They are about consistency and mindfulness. Think of them as a daily tune-up for your body's most vital systems. For most men, 2 to 3 sessions per week are enough to start. Each session should take no more than 10 minutes, moving through all 3 points in sequence: perineum, inner thigh, and lower abdomen. Always use gentle pressure, firm enough to feel, but never to the point of pain or bruising. If you notice soreness the next day, ease off and allow your body to adapt gradually. Breathing is key. As you apply pressure, focus on slow, deep breaths. Inhaling fills your body with oxygen, while exhaling helps relax the muscles and blood vessels you are targeting. Over time, this relaxed state encourages stronger, more natural erections. Avoid rushing the process. Erections are a complex orchestra of nerves, blood, and muscles, and retraining them takes patience. Remember, this is not about instant results. It's about reconditioning your body to perform the way it was designed to. And finally, listen to your body. If you feel sharp pain, dizziness, or discomfort, stop and consult a physician. These techniques are powerful allies, but like any health practice, they work best when combined with hydration, good sleep, balanced nutrition, and respect for your body's limits. Gentlemen, fading morning erections are not the end of your story. They are simply a signal, a reminder that your body needs attention, not surrender. With just a few minutes of focused pressure point work, you can reawaken the very systems that have carried you through life: your nerves, your circulation, your muscles, and your confidence. Imagine waking up tomorrow and feeling that familiar firmness again, not because of a pill, not because of some risky treatment, but because your own body remembered what it was always capable of. These pressure points are not magic. They are biology, waiting for you to rediscover it. So take this knowledge, practice it with care, and give yourself permission to feel alive again. Age does not define your vitality. With consistency and respect for your body, you can rise each morning stronger, steadier, and more connected to the man you have always been.